How much should you charge for your cash pay physical therapy services? This is the most common question I get from other PTs looking to transition to cash pay PT. They know they want to go cash pay, however, they don't know how much they should be charging. So in this video, we're going to break down the details on how you should structure your pricing with your cash pay PT services. First thing first, it depends on your confidence and expertise. With that said, do not misinterpret experience as expertise. You do not need to have 10 years of experience to be an expert in your field. As long as you're confident to get your clients the type of results that they deserve, you can charge accordingly. All right, let's do a little thought experiment here. Pick a number in your head of how much you believe you should be charging for your services. Take a second, have that number. Now multiply it by 1.5. That's how much you should be charging at a minimum. As PTs, we're conditioned to believe our services are less valuable than they really are. Personally, I would not charge less than $200 per hour minimum, and it's very feasible to charge $300 or more per hour, because if I could do it as a new grad PT, you could do it too. Next, instead of thinking about charging for physical therapy, let's do a paradigm shift. Let's think of this as, instead of charging for physical therapy, we're charging for having the ability to create solutions for your clients' issues. As physical therapists, our expertise is more valuable than we even realize. So let's go through some examples. Say you have a college athlete that's injured and hasn't played at their full capacity for over a year, and then you create a solution for their issue, and now they're back on the court playing at 110%. What is that worth to your client? Or say you have a grandparent, and this person, they just want to enjoy their grandchildren. However, because of their back, they're not able to play or pick up their grandchildren. What is your solution for their problem worth to them? That's how I want you to start thinking about these things. And in reality, we have the best ability to provide massive value in a cash pay setting, because we're not dealing with the restrictions of health insurance and corporate medicine. So the next time you feel bad about charging a lot of money for your services, think of it this way. If you're charging a lot of money and your clients are happy with your services, then you are a valuable physical therapist. And a funny part about charging more for PT is that your clients will actually get better outcomes because they're more invested into their plan of care. So think of it from a psychological standpoint. If someone's spending a lot of money on a service, they're more invested into it. If they're more invested, they're going to stick to their plan of care, they're going to do their HEP, and they're going to get better outcomes because they're actually doing what you're telling them to do. I know from personal experience, if I do PT for free for friends or family, they're never compliant with HEPs and they don't get better. So do your clients a service and charge them more money so they can actually get better. In summary, you should be charging a lot more for PT than you think. If you do, your quality of life is going to be a lot better and your patients will actually get better outcomes. If you don't feel confident charging for PT, it's one of two things. Either you're not confident in your clinical skills and they need improvements, or it's your mindset. You don't believe that PT is a valuable service. Regardless, these are both concepts that we're going to address in further videos, so stick around. If you liked today's video, hit the like button, hit the subscribe button. If you didn't like today's video, leave me a comment below and tell me why. Regardless, I appreciate all your feedback and I look forward to future videos.